Well, this month we all have a chance to help out an organization that has been crucial to our community. The Shine Bright for Kids fundraiser is happening right now, raising money to support children facing cancer or blood disorders. And to tell us more, we're talking with Teresa Harridge from Children's Minnesota, as well as music therapy supervisor Sarah Willever. Thanks so much for joining us.
Thanks for having us.
Yeah, so for our viewers out there, can you tell us about the kids you care for in your program, Teresa?
Of course. Children's Minnesota cares for a majority of the children and young adults who are diagnosed with a cancer or blood disorder in the state of Minnesota. When we meet these patients and their families, we're often giving them, the worst news that they might ever hear, because nobody wants to hear if their child or young adult is diagnosed with cancer or a blood disorder. So when we meet them with a big supportive multidisciplinary team of experts. And this multidisciplinary team consists of either their primary hematologist, oncologist, advanced practice provider, nursing assistants, music therapy, or child life specialists. And we continue to meet the family where they are and support them throughout their journey with us.
Absolutely, such important work. And you mentioned music therapy. Sarah, I know music can get folks through a lot of things. How does music therapy play a role at Children's?
Yes, well, like Teresa said, we are an integrated part of the services that we provide for the patients. And so it might look like singing a patient's favorite song while they're getting a poke or a procedure, and doing that helps the kid to take deep breaths, but also gives them a focus to that's something else besides what's happening, the procedure, but then also might be a timekeeper or give them some ideas of the steps of what's happening to their body. And so it can be a really nice learning way to make it be successful for them. We also, a lot of times get the kids up and moving. They've done a lot of work or trying to recover from surgery or not feeling well, and so we can get them up and moving. I love making drum kits that get the kids up and standing, sitting up, moving their body the way that they need to be moving, and I collaborate with nurses and with rehab staff as well to really get the kids up and healthy and being successful with all their treatment.
So important. And I know during break too, we were talking that the music therapy helps the staff too. So, I mean, all around very helpful. So before I let you go, for our viewers, where does community support and donations come into play for Shine Bright?
Children's Minnesota is a nonprofit healthcare system, so donations are vital for us to continue to provide care to our patients and families. So these donations ensure that we are able to continue to provide the excellent care that we do for patients and their families, and offer them support throughout their entire treatment. This donation specifically for the Cancer Kids Fund, which is what we call this for our cancer and blood disorders patients, help alleviate that financial stress that patients and families might have going through therapy, because they need to continue to pay the bills, right? It might offset some of their financial stress of mortgage payments, rent, car payments, meals, gas to and from the clinic. But kids still need to be kids, and so do young adults. And it does fun things too, like pays for art supplies and nail polish or gaming systems to help them also be kids while they're in the clinic, infusion center, or hospital or receiving treatment with us.
Absolutely. Thank you so much for telling us about this fundraiser, and so we can help, because the community needs to be involved. We have more information on how you can help out at KARE11.com/noon, and stick around because we'll see Sarah again in a little bit for a special performance. We'll be right back.